More than 75% of people take supplements, but just because they're labeled natural doesn't always mean they're safe. And right now, rates of liver injuries from some of those supplements are on the rise.
Our 9 News health expert, Dr. Payal Kohli, is joining us now to talk a little bit more about the health risks from taking supplements. Dr. Kohli, good morning.
Good morning, guys.
First of all, I think it's important to note that not all supplements are FDA approved. And like Corey just mentioned, just because they say they're natural, that doesn't always mean they're safe.
No, in fact, no supplements are FDA approved. You can actually market a supplement without any pre-approval research or anything like that. So essentially what the FDA does is allows them to go on market and then watches to see, almost like a human experiment, if there are rates of liver injury, kidney injury, any sort of toxicities that come out of it. So you have to be really careful about putting these inside your body. And people have the impression that if something is natural, that it's good for you. And in fact, the people that use the supplements are the ones that don't generally want to come to doctors or take medications. But in fact, low doses of natural things like turmeric, for example, in cooking can be good for you, but high doses can actually be toxic.
Yeah, so talk specifically about some of these liver injuries that doctors are seeing. What supplements are causing that?
Yeah, so in the last 20 years, there's a study that just came out that says that the liver injuries have increased up to 8-fold.
Wow.
And some of these have actually resulted in death. And if you think about when you take a pill, what happens? The first thing that happens is it goes to your liver, and your liver breaks down kind of everything in it. And with these supplements, a lot of them have contaminants in it. A lot of them can cause direct injury to the liver, and a lot of them can actually interact with other medications that you might be taking, and that's how they injure the liver. So the fact that people are using more supplements and we're seeing a rise in supplement-associated liver injury has really been alarming.
Hearing that should kind of raise everybody's cautionary flags a little bit before reaching for that next supplement. What should we keep in mind when it comes to the safety of these supplements?
So I think you have to remember that because they're not FDA regulated, the doses can be highly variable. And again, they can interact with other medications that you take. So I would say, do not start a supplement without talking to your doctor. It's really very important to get doctor's approval. Just because they're accessible to you over the counter, you can't just start them. And it's not just your liver, even your kidneys. These are the organs that detox our bodies that can be at risk with these supplements. Now, some of these supplements can even have effects like turmeric on thinning your blood and increasing your risk for bleeding. So you have to understand they're almost like medicines that you're using without a prescription. So you have to be real careful.
It's so interesting because I was reading about this and it said like turmeric is one. You would think that's like easy. Green tea and ashwagandha. I mean, those are things that
you feel like are very natural,
Right.
good for you. Yeah.
but not so much.
Not at all. And again, it's probably a dose effect, probably effect of contaminants or binders or other things in those supplements. We even see red yeast rice, which a lot of people use for cholesterol, being associated with a high risk of liver injury as well. So
it's really interesting because, of course, as we're talking about all of that, it really just goes to show you how good these marketing departments are at convincing us of all this stuff. One thing I thought was interesting that Corey was mentioning is when we're talking about supplements, we're not just talking about things that maybe bodybuilders or people want to lose weight are using. We're talking about multivitamins as well.
that's right. And in fact, multivitamin is the most commonly used supplement. We see women use supplements more than men. And generally, people with higher income and higher educational status use them more. But we're even seeing older adults who are higher risk for organ damage use a lot of different supplements. So you're right, Jordan. We used to think it's just creatine and some of those bodybuilding things. We're seeing teenagers and adolescents use more supplements than ever too. So I think being really, knowledgeable about supplements, the fact that they're medications, the fact that they can interact with things, and making sure you check the FDA databases on adverse events before you think about putting anything in your body that isn't FDA regulated.
Are there any supplements that are like tried and true at this point in time that's pretty safe?
There are a few. So I use a few myself. So the first one that I use is magnesium at bedtime. It's really good for your heart. It's really good to help with anxiety. It helps you sleep better. So that's usually a pretty safe supplement for people who have normal kidney function. They can just sort of excrete what they don't need. Vitamin D is another supplement, especially in people who are deficient, but in most people, you want to keep your levels around 40 to 50. If it gets too high, you can get kidney stones. But most of us run around with levels less than 30. We're deficient because we spend most of our time indoors. And a new study, in fact, just came out linking vitamin D to reducing aging. It changes the way your chromosomes age and biological aging. So vitamin D is another that I recommend to most of my patients. Not a fan of the omega-3s, not a fan of the multivitamin. If you're eating a good diet, you really should not need to take a multivitamin. And some supplements like beta carotene actually cause cancer in people. So again, you want to be really careful about too much of of a good thing can be a bad thing.
Make sure you do your research, and again, talk to your doctor before doing so. Dr. Kohli, thank you very much for talking to us. We
you.
appreciate it.